Hi, I'm Brianna. I'm going to be taking a couple x-rays of you today. Can I verify your name and date of birth?
Yes.
What's your name?
Jared DeBruller.
And your date of birth?
12/10/93.
Awesome. Any chance of pregnancy?
Nope.
Okay, kind of have you put this gown on and remove your shoes, socks, and any jewelry that you might have on.
Sounds good.
Okay. Okay, for my next exam, I'm going to do an AP knee. For this exam, I'm going to use a 10x12 cassette with a 40-inch SID tabletop. I'm going to be centering 2.5 inch below the patellar apex. Right here. I'm going to have the legs straight out and make sure that the femoral condyles are parallel to the IR with no rotation. This one I'm going to have a degree of angulation on my tube. That degree of angulation is dependent though. If the pelvis on the patient is less than 19 centimeters tall, then I'm going to have a 3 to 5 degree angulation coded. If their pelvis is 19 to 24 centimeters tall, in that range, then there's going to be 0 degree angulation, and if it's larger than 24 centimeters, then I'm going to have a 3 to 5 degree angulation on my tube cephalid. For my collimation on this exam, I'm going to collimate to 8 by 10 inches and then bring it into an inch on either side of the leg. Again, centering 1/2 inch below the patellar apex. And shield the gonads, place our left side marker for the left leg, make sure there's no rotation, and click for our AP knee. Okay, for the next exam, I'm going to do a medial oblique. Again, I'm going to use a 10x12 inch cassette with a 40-inch SID tabletop. The angulation on this exam is going to be the same as it was for the AP knee. Being that if the pelvis on the patient is less than 19 centimeters, then you're gonna angle the tube 3 to 5 degrees coded. If it is between 19 and 24 centimeters, then you're not gonna angle the tube. And if it's greater than 24 centimeters, then you're gonna angle the tube 3 to 5 degrees cephalid. For this exam, we're gonna again be centering 1/2 inch below the apex of the patella. However, we're gonna rotate the entire leg 45 degrees inward, about right there. Centering 1/2 inch below the apex of the patella. Your scar makes it hard to feel. Marking for the left side, shielding the gonads. And our collimation is going to be again the same as the AP knee. It's going to be brought out to 8 by 10 inches and then suck it in on the sides to 1 inch on either side. Should you stay rotated? All right, and click for our medial oblique. Lastly is our lateral knee. Same size of cassette, using a 10x12 cassette, 40-inch SID tabletop. The angulation on this one is going to be 5 to 7 degrees cephalid towards the patient's head. We'll rotate laterally for this exam, and you can bend your knee. Bend this knee 25 to 30 degrees. Is that okay if we get that out of the way? Sorry. Okay, so the knee should be flexed 20 to 30 degrees. The patella and the epicondyles here should be perpendicular to the IR. And here we're centering to the knee joint and at 1 inch below the medial epicondyle. So I'm going to bring this in just a smidge, about right here. Making sure we're the true lateral here. Marking for the left side, and the collimation on this one is going to be 8 by 10 inches, and then we'll bring it in to 1 inch posterior and anterior to the patella and the posterior shadow. Shielding for the gonads, markers placed, and click for our lateral knee.